In the presence of shadows, the potential for new light gains form, awaiting only the arrival of a spark. The New Day study aimed to evaluate the efficacy and safety of the fluocinolone acetonide implant as baseline therapy for diabetic macular edema, seeking to address treatment gaps with current therapies. This was an 18-month prospective, randomized, single-masked, active-controlled Phase 4 study enrolling adults with type 1 or 2 diabetes and central involving diabetic macular edema. A total of 306 participants were randomized from a screened population of 517. Participants received either the fluocinolone acetonide intravitreal implant with potential rescue injections of aflibercept or an aflibercept regimen consisting of an initial loading dose series followed by possible supplemental injections. The primary endpoint was the mean number of rescue supplemental aflibercept injections required over the study period.
Quick take. This trial studied whether combining FAC implant with rescue aflibercept is as effective as aflibercept alone, focusing on injection needs.
The primary endpoint results showed that the mean number of rescue supplemental injections did not significantly differ between the fluocinolone acetonide and aflibercept groups at 2.4 versus 2.5 injections, with a p-value of 0.76. With both protocol-mandated and rescue injections considered, the fluocinolone acetonide group required significantly fewer injections overall. The time to first rescue injection was longer with fluocinolone acetonide, with a mean of 185.4 days compared to 132.8 days for aflibercept. Visual and anatomical outcomes were comparable between groups. However, fluocinolone acetonide was associated with a higher rate of cataract procedures and increased intraocular pressure episodes. The authors conclude that fluocinolone acetonide achieves similar outcomes to aflibercept with fewer total injections, though monitoring for cataracts and IOP is imperative.
Quick take. Although both groups showed similar visual improvements, the FACE group needed fewer injections, but more frequent cataract monitoring is needed.
Short quiz, clinical vignette. Question. A 57-year-old female patient with type 2 diabetes presents with center-involving diabetic macular edema after previous anti-VEGF treatment. Her most recent CST is confirmed elevated. Which therapy strategy may reduce the frequency of injections while maintaining similar vision results? Option 1. Aflibercept loading dose followed by PRN aflibercept. Option 2. Fluocinolone acetonide implant with supplemental aflibercept if needed. Option 3. Monthly aflibercept monotherapy. Option 4. Observation without further intervention.
The answer is option 2. The New Day study demonstrated that fluocinolone acetonide as baseline therapy with supplemental aflibercept reduces the overall injection frequency while maintaining similar visual acuity and anatomical response compared to aflibercept monotherapy.